Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the Tetralogy of Fallot. Tetralogy of Fallot is a group of congenital heart defects. Okay, this is a group of congenital heart defects. It is one of the common congenital heart defect. The prevalence is 1 in about 3,000 live births. So we had 4 defects. These are the pulmonary stenosis, right ventricular hypertrophy, right ventricular hypertrophy, overriding of the aorta, so we'll go through one by one. We had the pulmonary stenosis. Here is the pulmonary stenosis, number 1. Number 2 is the right ventricular hypertrophy. This is right ventricular hypertrophy. Then we'll get overriding of the aorta. This aorta it gets blood from both the left ventricle and right ventricle. This is the aorta. So it is receiving blood from both the left ventricle. Blood is going from the left ventricle. Blood is going from the right ventricle. Okay, we got. And number 4 is the ventricular septal defect. Ventricular septal defect. Okay, so we got the components of the tetralogy of Fallot. Tetra means 4 problem. One is pulmonary stenosis. This is the pulmonary trunk. This is the pulmonary artery. The left pulmonary artery, right pulmonary artery, pulmonary trunk is here. Pulmonary trunk. This is pulmonary trunk. Left pulmonary artery, right pulmonary artery. Okay, like if you go to this model, this is the pulmonary trunk, left pulmonary artery, and this is the right pulmonary artery. Okay, so here what happened, the pulmonary artery is stenosed. Stenosed means narrowing of the opening, or some opening is closed significantly, so flow is less. So here number 1 is the pulmonary stenosis. This is the normal pulmonary trunk. This is the stenosed pulmonary trunk. Okay, then right ventricular hypertrophy. This is the right ventricular wall. It should be around 1/3 the thickness of left ventricle, but here it is normal. If it is 3 centimeter, it should be 1 centimeter. Its ratio of thickness of the wall of the ventricle is 3:1. Okay, here right ventricular hypertrophy, right ventricular wall is as thick as that of the left ventricular wall. Myocardium is hypertrophied. Overriding of the aorta. Aorta is large here. Aorta is large and it is overriding over the ventricular septal defect. This is the interventricular septum. This is the interventricular septum. Interventricular septum. Okay, so there is defect in the interventricular septum, especially upper part of the interventricular septum, the membranous part of the interventricular septum. There is a defect here, and aorta is deviated towards right, and it is getting blood from, this is the left ventricle, this is the right ventricle. It is getting blood from both the left ventricle and right ventricle because aorta is deviated towards the right. Aorta is over the ventricular septal defect. There is a hole here, so the blood from right ventricle goes to the left ventricle, and aorta is getting blood from both the right ventricle and left ventricle. Okay, we got that. These are the components of the Fallot tetralogy. Again, let us summarize. Pulmonary stenosis. Pulmonary is stenosed. If it is stenosed, then the artery, the left pulmonary artery, right pulmonary artery is also stenosed. So lung will get less blood supply. Okay, and there is ventricular septal defect. So blood from right ventricle will go to the left ventricle because right ventricular blood cannot go to the pulmonary. Right ventricular blood is facing a lot of resistance to go through the pulmonary trunk. It is stenosed. So a significant part of blood of the right ventricle goes to the left ventricle. Okay, we got that. Due to this work, right ventricles work against resistance to propel blood to the pulmonary trunk, the stenosed pulmonary trunk. So right ventricle will be hypertrophied because it is working against resistance. Okay, so that is the reason for hypertrophy of the right ventricle. This is hypertrophied because it is working against the resistance, against the stenosed infundibular. It is working against the resistance of the stenosed outflow tract of the right ventricle. We know that blood from right ventricle goes to the pulmonary trunk, then pulmonary artery to the lungs. So these are the defects of the etiology of Fallot. Okay. Now, how a child present with Fallot etiology? It is a congenital heart defect. It may manifest in very early infanthood, depending on the status of stenosis. If it is too much stenosed, then manifestation should be early. If it is less stenosed, then manifestation may be late. Okay, so it is a cyanotic heart disease. So there will be cyanosis. Cyanosis means blue skin coloration due to lack of oxygen in the blood. Okay, so blue color skin, blue color skin. Okay, tiredness because lack of oxygen that cause the toddler or the child to be tired very easily. Often take squatting posture. Especially during some episodic condition, there is called Tet spell. Okay, Tet spell that happens when the child is exhausted by exercise or eating food or agitated for any reason. That may lead to episodic cyanosis, too much cyanosis, because pulmonary circulation is very much is less, so that lack of oxygenation that lead to tet spell, and if the child take the squatting posture, then there will be increased venous return. There will be the magnitude of right ventricle to left ventricle shunt will be decreased. Lung will get more blood supply. So squatting posture has some advantage, especially in case of tet spell. Okay, so that is the condition. And failure to thrive, because of lack of oxygen, the child don't grow properly, body weight is usually decreased. Okay, that is the condition. So we got this, and the child will develop clubbing of the fingers, especially the distal phalanx. The nail will be convex and soft tissue will be thickened at the nail bed area. Okay, we call it clubbing of the finger. This is the manifestation of the cyanotic heart disease. So how the heart look like? This is normal heart. Okay, this is the heart of Fallot's tetralogy. Fallot's tetralogy or tetralogy of Fallot. Tetralogy. We got the pulmonary stenosis, right ventricular hypertrophy, ventricular septal defect, VSD, that is number 3. Okay, and juxtaposition and overriding of the aorta juxtaposition. Okay, that is number 4, but we can add here juxtaposition or overriding of the aorta. Juxtaposition, aorta is deviated towards the right. Aorta is comparatively larger than that of the pulmonary trunk, wider aorta. Juxtaposition and overriding of the aorta. Aorta is riding over the left ventricle and right ventricle. So these are the 4 components. This is number 1, pulmonary stenosis. Pulmonary stenosis. Then this is right ventricular hypertrophy. Okay, right ventricular hypertrophy, and this is the ventricular septal defect. Okay, so we got, and juxtaposition overriding of the aorta. This is VSD. Okay, if we add, we can put the number anyway. Pulmonary stenosis, ventricular septal defect, right ventricular hypertrophy, and juxtaposition overriding of the aorta. These 4 are the components of Fallot's tetralogy. Okay, we got that. Now, what is the embryology behind it? Why this happened? Why not this is normal? How it look like? It look like a tetralogy of Fallot. It looks like boot-shaped heart. Why boot-shaped heart? Because right ventricle will be hypertrophied, so it looks like a boot-shaped heart, like that, boot shape, because of hypertrophy of the right ventricle. Okay, so we got boot-shaped heart on our radiological examination. So what is the embryology behind it? Embryological reasoning and embryological regions for tetralogy of Fallot. Tetralogy of Fallot. Why this happens? Tetralogy of Fallot happens due to anterosuperior displacement of the infundibular septum. This is due to anterosuperior displacement of the of the infundibular septum, Okay, this is the reasoning, the basic defect. Then asymmetrical fusion of the truncoconal rays. Asymmetrical fusion of the truncoconal rays. Okay, so asymmetrical fusion of the truncoconal regions and the malalignment of the aortic and pulmonary valves, and malalignment of pulmonary and aortic valves. Okay, so we got the embryological mechanism of tetralogy of Fallot. What is the exact cause of tetralogy of Fallot? Why this embryological lesioning happens, we don't know, but we have some predisposing factor may be related to that of the tetralogy of Fallot. Okay, like we have some predisposing factor, we can call it possible predisposing factors, possible predisposing factors. We don't know the exact cause, like that of maternal alcoholism, maternal malnutrition, gestational diabetes, mellitus, okay, there may be association with Down syndrome, or viral infection like that of rubella or German measles, or it may be due to in association with DiGeorge syndrome. Okay, DiGeorge syndrome, we know that lack of thymus and problem in the third and fourth pharyngeal arches. So this may be the possible predisposing factors. Okay, so what is the management? Management, it will be managed by the surgeon, the pediatric surgeon who is specialized in management of the congenital heart defects. Okay, so management should be done by a surgeon. Management is surgical. Okay, prognosis is variable depending on the level of stenosis of the pulmonary trunk and the time of diagnosis. So that's all about the Fallot's tetralogy. If you have any question, please feel free to ask me. So please share the information with your friends. Please support my channel. Please subscribe me. Have a nice day. Bye now.